Hey, I'm Katherine Pannel. I'm a psychiatrist in North Mississippi. I'm also the medical director of Right Track Medical Group, and I serve on the board of the Mississippi State Medical Association as well as the Mississippi Psychiatric Association and MoMA. When Ken Mathis with MSMA approached me about doing a four-part series about mental health and the pandemic, dare I say, excited just because I feel like there is a plethora of information about COVID on how to prevent COVID, what is COVID, what to do if you think you have COVID, treatment of COVID. But there's just not a whole lot of information about the mental health ramifications of COVID. I want to make sure that I start off the series by saying that the emotions and feelings that you have surrounding the COVID virus itself are totally normal. We're all adapting to a new norm that is really ever evolving day to day. We started with social distancing and, told everybody, stay 6 feet apart, but that's evolved now into an executive order by Governor Reeves of a shelter in place. So now we are in our homes and we are encouraged to stay there unless there's something that we just have to emergently get out for, such as groceries. So change is anxiety provoking, and it seems like things are changing daily as far as numbers of cases of COVID, number of deaths, the recommendations for what you should do during the shelter in place or not do. And this lack of control and this change can be very anxiety provoking. Also, just change, but the fear of the unknown causes great anxiety. And I feel like if we really acknowledge our symptoms now and tackle them now and do precautions just as you would for COVID, that you can prevent mental illness in the I'm certain that we're going to beat COVID. We're going to look up and this is all going to be behind us. And, the physical, the COVID virus itself is going to be long gone. But if we don't put precautions in place and tackle the issues now surrounding mental illness, those are going to be the lingering ramifications after the virus. So just as you would do precautions for COVID, such as, washing your hands, do the social distancing, cover your cough, disinfecting surfaces, getting plenty of rest, stay hydrated. There's certain things that you can do to prevent getting mental illness. And I'm really excited to talk about it in this four-part series. I think today we'll basically just talk about anxiety and depression that's coming from COVID, just basically acknowledging that that is going on. And then modules 2 and 3 will identify more about what you can do about the symptoms and children, talking to them, the adults, the healthcare workers. And then in module 4, we can kind of wrap it up and review everything. And then if you have any questions, I'd love to hear from them and answer them as well. So for today, I just want to make sure that the main message is that you do know that the emotions that you're experiencing now are normal. Like I said, there's anxiety, the fear of the unknown. We also get great anxiety when we can't control things. And this virus is something that none of us have control over. We can't predict who's going to get it. Actually, this is a very unpredictable virus that, because it's so new, not even the experts know how to control it, how to treat it. We are still working on all of that. But if you get so wrapped up in things that you can't control, you start getting more anxious. So you just got to put the brakes on, really just focus on today, things that you can control, which are the things that I mentioned about preventing the COVID. So, washing the hands, not going to the grocery store unless it's absolutely necessary, wearing the mask in public. Those are things that you can control, that you are able to focus on control and reduce anxiety. I think a good way to kind of make sure that you are controlling things of today is, exercising, staying well nourished, well hydrated. Those are things that you control. So you get a little peace in knowing that there are still slivers of things in our lives today that we can control. Also, this fear of the unknown, this affects everybody from children all the way up to adults and geriatrics. I did not fully realize the impact that this virus was having on our youth and even our tiny children until one day I was carrying my 4-year-old on my hip, and he just had a little cough. It's probably allergies. who knows? I mean, he's not sick. And he immediately, just squeezed me tight and said, "Oh no, mom, am I getting the coronavirus?" And I think it was in that moment that I was like, wow, even the little itty bitty children, like they're sensing something, whether it be the anxiety in their parents, or they have full knowledge that there's a virus, a COVID virus that can make people sick and potentially die. They get it. Communication is huge with this age group. They have that anxiety that, what is the COVID? I've never heard of this. Mom and dad seem really anxious and nervous about this. It really appears to be affecting them. Will mom and dad get this virus? Will I get this virus? If mom and dad get it, well, how will they take care of me? Are they going to die? Those are the kind of anxieties that the little children feel. Older children, teens, they're wondering, when is life going to get back to normal? I know my 9-year-old is very observant, and she's getting very antsy, and she wants to know, when is life going to go back to normal? Am I going to get to go back to school this year? Or am I going to get to go back to school ever? I miss my friends. When will I get to see my friends again? Will I ever get to play with my friends again? They really are seeking answers to when normal will come back, and then compound their, wanting normalcy with the fears that they too may get sick. What are they going to do if their parents get sick? Who's going to take care of them if something tragic should happen to their parents? Adults. Adults have a lot of anxiety about this virus. They not only worry for their own health, but they worry for the health of their children. Not in just that they fear that their children will get sick and die, but also if parents get the COVID virus and they have to quarantine for 2 weeks, who will take care of their children? Because we're a shelter at home, and we are supposed to stay away from others. So how will they take care of their kids? What if we all get sick? What do we do then? They also, we adults are to an age where we have to worry about our parents. Most of our parents are in that subgroup of people that really are at high risk, and we know that, and we're anxious about the health of our parents. If they were to get it, who's going to take care of them? How will we be able to take care of our sick parents should they get COVID? How are they going to get groceries? And also just how are they faring mentally? I mean, knowing that they are in that dangerous high risk subgroup. That leads me to that population and their worries. I can't imagine the anxiety and fear that they are having. They're our precious, wonderful geriatric population that have seen so much, but many have not seen a pandemic. I imagine there is a small group that had lived through the Spanish flu, but this is also new to that population as well. And knowing that you're in that high risk category, the fears surrounding, like, what am I going to do if I get this virus? Who will take care of me? Who will take care of my spouse? And that even their kids, they're still their kids and their babies, and they worry about their children getting COVID as well. But then there's also this special subset that are the healthcare workers, the physicians, the nurses, that they all have their own personal life, and so they take on those adult worries about their families and friends as well. But now they have to worry about patients. What are we going to do if we run out of the hospital equipment? How will decisions be made about who gets what? How can I take care of my patients? Will they survive? Will they pass away? Then there's, fears for themselves. Will I have enough personal protection equipment to protect myself from getting the virus? And if we don't have enough, will I get in trouble for speaking out about it? Then the fear of, if I do start presenting symptoms of COVID, I have to quarantine for 2 weeks and can't be around my family. And who's going to take care of my family and make sure that they're okay? So there's so many reasons to have anxiety during this time, and it is not abnormal. It is totally normal that we're all feeling this, but this is where we got to really learn how to cope and deal with it. And outside of anxiety, then there's this depression that comes along with this shelter at home, this social isolation. Humans are very sociable species. We want to connect with people, not only audio, visually, but we crave touch. Touch is comfort. And with this social distancing and shelter at home, we are removing that whole that humans so much. I know there are jokes going around on Facebook and social media about this being an introvert's paradise, but it's even affecting introverts. To some point, even introverts crave social interaction. So social isolation is affecting us all. We are so ready for a normalcy to return. Social isolation can be very dark, it's deep, and it can be very depressing. One of the most important risk factors in getting depression is isolation. Isolation is hard. Isolation is also a huge risk factor in suicide. Unfortunately, we know that right now that we've seen a spike in suicide by 40%. I mean, it is really affecting us. We need social communication. But there's ways to deal with that too. And I think that's where the next part of this series comes into play, where we are going to learn how to identify these symptoms and cope with these symptoms. But I think it's very important for me to end every single module saying that there's a part where all of this is normal, but then there's a part where this doesn't qualify as normal anymore. And if you're having those thoughts where you've just given up, there's no purpose in life anymore, or you're having thoughts of suicide, you've got to reach out to a professional. We are lucky that we live in such a wonderful time of technology. Most psychiatric clinics are still able to do therapy, medication management via telemedicine. But if you're not able to connect that way, or you can't find a provider to talk with and discuss your issues, your concerns, your feelings of wanting to end life, then I encourage you to either call 911, or there's the National Suicide Hotline, and also talk to them, because as normal as it is to have anxiety, fear, and to feel down during these times, it's never normal to want to end your life. So I encourage you to reach out if you get to that point. But I'm excited about continuing the series. I hope everybody will get some benefit out of it, even if your children want to watch, up to your parents and grandparents. I hope that this is beneficial for everyone. So I'm excited to see you for the second part of this series, and I'll sign off for now. So thanks for listening. Bye.